Hi, my name's Adam, and my multimodal project is on access to HIV preventative care. My target audience is teenagers in homophobic communities. I think that they are underrepresented and deserve more education around this.
HIV is a virus that attacks a person's immune system. Most people get HIV through anal or vaginal sex or by sharing needles and other drug injection equipment with a person who has HIV. HIV can also be passed by a pregnant woman to her baby during pregnancy, childbirth, or later through breastfeeding. Without treatment, HIV can make a person very sick or even cause death. The only way to know if you have HIV is to get tested. Knowing your status can help you make healthy decisions. To prevent getting HIV, take medicine called PrEP if you're at high risk. Always use condoms or clean needles, never share needles, or choose not to have sex or inject drugs. If you have HIV, get in care and take HIV medicine as prescribed. With the right medical care, you can live a long, healthy life and prevent transmission to others. For more information on HIV, visit cdc.gov/HIV.
So HIV preventative care is important because it is treatable, it's preventable. You can prevent death. It's life-saving treatment, especially if you go without treating AIDS or you never got tested. It negates fear and helps end stigma. It helps with sex shaming, slut shaming, and it helps with the inequity within the gay community, Black community, um, and those who use needles and drugs. What does preventative care look like? So we have to talk about infrastructure. Do you have access to sidewalks? Do you have a car? Are you able to take a bus or a train somewhere to get treatment? We have to talk about tools and resources. So do you have access to the internet? Can you get on the CDC's website and look up local testing centers? Um, your support system, your people. Are your parents homophobic? Will they find out if you're treating HIV or preventing it through your insurance? And then education. Are you educated on HIV? Are you aware that it can be prevented? And are you aware of the risks? I'm showing you this graph or this chart here to show that male-to-male sexual contact is the #1 way AIDS is transmitted. But I also want to point out that injection drug use, we don't necessarily associate AIDS with drug use or needle sharing. This is prognosis of HIV, so it shows how it goes from HIV infection to something acute, then a chronic HIV infection, and that leads to AIDS. It happens over a certain amount of years. And if you are diagnosed with HIV or AIDS, you can live a long, healthy life with treatment. You can be undetectable, and you don't have to worry about transmitting it to your sexual partner if you're getting that treatment. So these are the regions most affected by AIDS. The South makes sense, lack of infrastructure, and they have homophobia. Now, the Northeast is interesting. You wouldn't necessarily associate that with AIDS just because they have tools and resources, infrastructure, all that. But it's really coming from New York and New Jersey, just those high populations. They have a high prevalence of AIDS. I want to show you this graph to show how disproportionately the Black community is affected by AIDS. Black men especially, but I also want to talk about Black women. They're significantly affected and they're often not included in the narrative around AIDS.
What is hidden for fear of public shame, imprisonment,
torture, or in 7 countries even
the death penalty?
What tears families apart?
What makes people confront brutal violence on a daily basis?
What simple trait
gets people treated as second-class citizens?
Everywhere they go.
What gets children kicked out of homes?
Students bullied and expelled from schools.
And workers fired from jobs without warning.
What has existed in every country throughout history,
but some people still consider
abnormal?
The answer? Being gay.
Being lesbian.
Bisexual.
Transgender.
So what does accessibility look like? Accessibility is a human and civil right. It is your civil right to have access to healthcare. When you talk about accessibility, you have to look at infrastructure and the environment and how people interact with your environment. So once again, roads, sidewalks, do you have access to a bus? Do you own a car? And then the barriers of accessibility, you have to think about what prevents people from getting healthcare. So there's barriers within the there's barriers with accessing HIV preventative care in politics, employment, the gay community, and medicine. So in politics, talking about Florida, there's a lot of anti-LGBT legislation throughout the United States right now, but Florida is especially a concern. They failed to extend Medicaid to low-income working adults, which is unfortunate because class is a barrier to healthcare. So employment, 40% of respondents said that they hid their sexuality at work, church, and in the doctor's offices from fear of stigma. Before 2020, people were getting fired for being gay, not from working through the government, federally funded organizations you couldn't get fired from, but if it was a private entity like a restaurant, something locally owned, you could get fired for your sexuality. There's barriers within the gay community itself, internalized homophobia, sex shaming, slut shaming, and then just in the medical community, does your doctor, are they educated on HIV preventative care? Do they have experience with it? So within the Black community, there's intersectionality of racism and lack of access to HIV preventative care. Young Black Floridians and those of Latin descent are also far more likely to be at risk, and these are the populations most likely to work at jobs that don't offer health insurance, with work hours that make it difficult to access healthcare, even if they can afford it. So you have racism at play here. These are people who are likely to work at places that don't offer health insurance. Health insurance in general discriminates against people of color, and especially Black women. You have to think of the BMI scale. And then if you're working multiple jobs, how do you have time to get healthcare? So there's 4 pillars of HIV prevention, and this is from the CDC: diagnose, treat, prevent, and respond. So diagnose, you want to use the latest technology and just be up to date. So the internet has a lot of tools and resources. We need to take innovative approaches, be creative. That's very important when overcoming barriers. Establishing regular testing is extremely important. Getting people in every 3 months to get a blood test and a STD screening. And then when diagnosing, you have access to testing locators through multiple websites. The CDC, if you go on to gettested.cdc.org, you'll be able to look up testing centers near you. So treat, early initiation of antiretroviral therapy. So getting on PrEP early as possible to prevent it. We want to support retention and care and adherence to medication. So doctors have reported that the most notable barriers to HIV prevention are non-compliance with therapy, acceptance of PrEP discussion among patients and parents, so just being willing to have the conversation, and the cost of therapy. So if you don't have insurance, PrEP is almost $2,000 a month. Who can afford that? And then supporting re-engagement care, encouraging people to come back, making it affordable, things like that. So prevent, these are the CDC's recommendations for prevention. So teaching children about sex education, talking about lube, condoms. To prevent HIV, we need to make PrEP more available, and that's pre-exposure prophylaxis. So we need to increase the number of clinicians offering it in general. And then having funding flexibility, creating equity. So yeah, if you don't have insurance, how can you have access to HIV prevention? And that's just, there are different programs that offer funding and help. This is something we've learned from Berlin, Germany's HIV prevention program. Some things that are successful is having the staff and volunteers represent the diverse group of people in the community that they're helping out. Something that also worked is just embracing homosexuality and the gay identity, which makes a lot of sense, decreasing stigma and creating awareness. And then just seeing eye to eye with people, meeting people where they're at. Something that could use improvement. They found that HIV, stigma, homophobia, and shifting attitudes about HIV definitely needs improvement. So respond, PAP, post-exposure prophylaxis. This is what you would get prescribed if you have already been diagnosed with HIV. We need to respond by collaborating with local communities, so doctors' offices, police departments, schools, medical systems. We need to educate doctors on PrEP and PAP, getting them more experience with prescribing it, dealing with the nuances, things like that. So you have access to tools and resources. If you go on the CDC's website, you can use their treatment center locator. In Ohio, there's the Ohio HIV Prevention Program. What's interesting is that anyone can become a member. So you or I, or businesses, different entities, things like that. Ohio also has a free condom program, as well as Butler County. So you can go on those websites and get condoms shipped to your door. Tools and resources. So ohiv.org is another organization through Ohio that provides free services. Once again, this is important for underserved communities. They also have a Facebook group, so you can stay up to date on that. So Equitas Health, I want to bring up Equitas Health because it's federally funded. So if you live in a state that has lack of access to HIV preventative care, at least you have access to something that's federally funded, and you can have access to different resources on their website. So HIV preventative care, it's important. It's easily treatable, it's preventable. Everyone has the right to access to healthcare, and those who are at risk for HIV have the right to access to HIV preventative care. So HIV preventative care, it's going to help end the stigma around HIV. There's sex shaming, there's slut shaming, and there's a lot of fear around having sex and getting and transmitting HIV. The most important thing is that you do have access to it. We need to let people know that you can get HIV preventative care. There are tools and resources out there. And yeah, it's up to you. It's all about doing the thing. getting on the internet, going to CDC's website. It's up to you. And thank you. That ends my presentation.